Well, good afternoon, everyone. This is Bill Costanzo, Livestock Guardian Dog Research Specialist at the AgriLife Center in San Angelo. I want to take a couple minutes before we start our webinar today to thank a few people. I would like to thank the Sheep and Goat Predator Management Board for making my position and this program here at the AgriLife Center. Dr. Redden, our director of the center here, and then also Robert Pritz for helping us out get the Zoom meeting going. Our sponsor today is Lone Star Tracking. If you're looking for any type of GPS trackers, contact Thomas or Mart there at Lone Star Tracking. We have several of those that we're trying out and using, and you can keep track of that kind of stuff that we're doing with those trackers on our Facebook page. One housekeeping thing, if you have questions, please post those in the chat room, and then we'll get to all those at the end of the program today. Our speaker today is Dr. Bethany Gibson. She completed her DVM at Ohio State University in 2011. After a year of mixed animal practice, she began a residency in Ethereogenology, I hope I said that right, Dr. Gibson, at Virginia Maryland College of Veterinary Medicine in Blacksburg, Virginia. Since completing her residency, she has returned to small animal general practice with an emphasis on small animal reproduction. She is currently an assistant professor at the Ohio State University College of Veterinary Medicine, working in the Frank Stanton Spectrum of Care Clinic. So with that, Dr. Gibson, I will turn it over to you, ma'am.
Thank you. Let me get screen sharing going here. All right. All right, you all seeing that? Hopefully.
Yeah, I can see you. You're
Perfect.
good.
Okay. All right. Well, thank you guys so much for inviting me to speak with you. I'm excited to kind of get to meet you, even from afar over Zoom. My hope is that I'm not going to be either too basic or too advanced, but certainly feel free to ask questions in the chat that hopefully we can get to at the end if there are more specific things that you were wanting to know about, or if you want me to go back and clarify anything. So yeah, just to revisit a little bit about me, I did get my DVM from the Ohio State University. We emphasized the "the" and we did try to copyright the word "the" a couple years ago. We weren't successful, but I'm sure the fight will continue. And after that, I did a Ethereogenology residency at Virginia, Maryland, or Virginia Tech. And since then, I've kind of gone back into general practice, but keeping my hands in small animal reproduction. So kind of making that a focus of practice. And then, yeah, very recently I transitioned out of private practice and back into academia, again at the Ohio State University. So Ethereogenology, I'm not surprised that was a difficult word. It's a made up word. We made it up in, I think it was the 70s or the 80s. And basically the thought is, Thereo is a Latin word that means beast, genealogy or gene means beginning, and ology is study of. So it's the study of reproduction of beasts. So Ethereogenologists, work in a variety of aspects of animal reproduction, and it's small animal, large animal, equine. So specific to small animal, things that we often work toward are like breeding management. So timing of cycles, artificial insemination, and that can happen with dogs who are located, all over the world, with the magic of FedEx and shipping semen all over the country and all over the world, and then even frozen semen as well from perhaps a dog that isn't even alive anymore. So we get pretty advanced and high tech. This is clearly not not the group that we that we think about when we think about frozen semen, like livestock guardian dogs. But just to give you an idea of some of the things that we do. So we work in pregnancy management, so identification of pregnancy and working with any problems that present while an animal is pregnant. We work in whelping and dystocia, so whelping being normal birth, dystocia being problem births. We work in postpartum issues with the dam that can crop up, neonatal disease, so problems in puppies, and then we work in infertility. It's important to note too that every small animal veterinarian does some of these things to some degree. Some veterinarians have more interest in repro and make that more a part of their practice, and some not as much. So specific to livestock guardian dogs, you all know way more about livestock guardian dogs than I do, and the specific, predilections of the breed and that kind of thing. In an informal straw poll with some of my veterinary repro colleagues, we all decided that they're pretty uncommon veterinary patients for us. I mean, I've certainly seen dogs like Great Pyrenees and things like that for other veterinary issues, but never for a reproduction issue. And so that's, in general, that speaks highly of your breed. It says that the breed is doing a pretty good job breeding on their own. Doesn't need a lot of help with fancy tools and artificial insemination and things like that. They typically have very good mothering instincts. Again, very good for the breed. The challenges that I can think of are, compared to other types of dogs, they do have a little bit more limited contact with humans for obvious reasons. So it's possible that we might not pick up on a problem with some of these guys quite as quickly as we might with, say a litter of poodles that's raised in somebody's living room. But you guys likely know lots more of the challenges and that kind of thing in the particular breeds that you work in, and I'm happy to chat about those, at the end of the talk. So just some basics on breeding, and this applies to really any breed of dog. Peak fertility for both males and females is about 2 to 4 years of age. So the 2 year in that 2 to 4 years, that's a pretty hard stop number for me. And that's for a couple of reasons. Most of our livestock guardian dogs are larger breeds. So we do recognize that their skeletal maturity is not complete until, say, 18 months or after. And we really want them to be skeletally mature before we ask them to reproduce. They also need to be able to prove their worth. So, they need to earn the right to breed. And what are their guarding instincts and how are they showing themselves as a worthy breeding candidate for what you're looking for. Some of the pre-breeding testing that we usually recommend for, say, the larger breed dogs often includes things like hip and elbow X-rays, just to screen for hip and elbow dysplasia. Your veterinarian can help you with other breed-specific testing that needs to be done, but the hip and elbow X-rays is kind of an across-the-board recommendation for most large breeds. And those things typically can't be done until about 2 years of age. And we know that litter sizes are usually a little bit smaller prior to 2 years of age. And we'll talk about, some of the difficulties that come with smaller litters. The 4 years of age, that's not a hard stop. So the peak fertility is 2 to 4, but I don't have any problem with breeding dogs out past that 4 years of age. It just means that that your litter size might go down slightly, or things like that. So definitely not before 2, but okay after 4. So I'd like to kind of walk through the whole cycle of canine reproduction, from breeding to pregnancy to whelping and that kind of thing. So let's start with breeding. The estrus cycle and the period of estrus in the dog, so the heat cycle, is variable in length. So although girls tend to be pretty consistent within themselves. So if you know history on this particular female, or potentially even this particular female's lines, you might know a little bit more. But any random female dog, could have a different length of estrus period, and then a different time in which she might ovulate then. So this, is always a very interesting number for me to go over with people, that from the dates from a single natural breeding to whelping, ranges from 57 to 72 days. So a 15-day window in a pregnancy that's, you know, only a little more than 2 months long, can vary by 15 days. That has to do with things like we don't know exactly the hormonal cycle of the female involved, and the fact that semen from a male can live in the female reproductive tract for up to 10 days and still be viable to fertilize eggs. So that isn't always a problem, but I just point that out, that, you know, it's hard to accurately predict a whelping date just from a breeding date. For animals that were, you know, working harder, or not, that we're going to breed, say, with some of those assisted reproductive techniques, ship semen, frozen semen, or for animals that we are expecting to have to do a C-section, it's really important that we nail down that accurate whelping date. And so we do that with hormonal testing LH, testing progesterone, or doing some vaginal cytologies, or some combination of all of the above. So you can see it's definitely possible to really nail down on that expected whelping date. It's, you know, like I said, the animals that we really need to do that on are the advanced repro cases, and or the girls that we expect to have to do a C-section on. So for most of your purposes, it's probably not necessary. I just wanted to let you know that it is possible if for some reason you need more information. So progesterone testing comes in a couple of kind of flavors. There's a quantitative test, which gives you an actual number. That test is helpful for identifying ovulation and really nailing down that day of ovulation and then the expected date of whelping. There's also a qualitative test out there, the Target test, if you've ever heard of that. Unfortunately, it's not helpful for breeding purposes. So if you thought about getting into progesterone testing, just make sure you're getting the right kind. So assuming we've gotten through the breeding and period and that kind of thing, then we want to think about testing for pregnancy. So pregnancy testing can be done as early as 3 weeks post-ovulation. So because that's 3 weeks post-ovulation, and a lot of times we don't know when that particular female ovulated. We know when she was bred, probably, but not when she ovulated. I often recommend that to producers that we back that pregnancy test up by a week or so, maybe come in about 30 days post-breeding. Hopefully that will be at least 21 days post-ovulation, and we have a good chance of confirming a pregnancy at that point. So 2 ways to do that. One is ultrasound, which is my favorite, because who doesn't like to look at little bouncing baby puppies on a screen? It gives us some idea of number of puppies, although I never give a complete number, but I will say it looks like there's a lot of puppies in there versus there's a few puppies, because I always look silly with an ultrasound. It's so easy to double count puppies or undercount puppies or that kind of thing. It gives us an idea of viability. So I can look at their little heart beating. And so that's one option. There's a blood test that we can do too, where we're testing for a hormone called relaxin. So that's another option if by chance, your veterinarian doesn't have an ultrasound or that kind of thing. That's another way that you can confirm pregnancy. Then the next confirmatory test that we want to do is what's called a PreWhelping Xray. So that can be done really pretty much during the 3rd trimester. So after day 45 or so. It's helpful to obtain a puppy count to get an idea of, okay, are there 4 puppies in this litter? Are there 12 puppies in this litter? And what to expect when she's delivering puppies at home. If there's 12 puppies in there, she's had 4, she seems to have stopped, delivering, then that there's potentially an issue here. Also helps us to identify, those smaller litters, those 1 and 2 puppy litters. I don't think that's a huge problem in your breed at all, but if by chance it would happen, you'd want to know about it. So this is probably a typical livestock guardian dog X-ray. It's clearly a small breed dog, but blow it up into a larger breed dog, and you can see all these little fetal skeletons. And so what we're looking for is this head followed by a neck and thorax, and we'll sit in a dark room and kind of adjust the contrast and come up with a really good count here. Puppies can often kind of hide in the colon area, next to poop and that kind of thing. So we'll mess with all the lighting and that kind of thing to get you the best accurate count that we can. What we want to avoid is something like this. So again, small breed dog. This is not a livestock guardian breed, but you can see it's one giant puppy who is sired by the Incredible Hulk. And so this puppy, this X-ray is taken at the time of dystocia. You can see that this puppy is half, his head has made it as far out of the birth canal as it's probably going to make it, and he's stuck. And so clearly the rest of this puppy is not going to come out naturally. And so had we taken a pre-whelping X-ray, we may have, recommended that this poor girl go straight to C-section when the time was right, rather than trying to have her deliver on her own. So this is just a kind of interesting picture of different, appearances of these pre-whelping X-rays. So an X-ray does not take the place of that timing that we were talking about kind of at the beginning of the breeding season, but we can get an idea. So you can see this 45-day fetus is, calcified enough to count. I can see a head and a neck and a thorax and that kind of thing, but I lose most of that, spine and the abdomen. There's very little in the way of like leg bones and things like that. Really just 5 days later, I can start to see a lot more detail. We suddenly have the whole spine. We've got, leg bones and that kind of thing. And then this term puppy, I can start to see things like toes. I can see teeth. I can see tailbones and that kind of thing. When I take a pre-whelping X-ray, I can't give people an exact, day, a day of whelping, but I can probably give them a, hey, it's going to be another couple of weeks or so, versus, oh my gosh, you need to go home and get ready for some, quickly arriving puppies. So whelping areas, ideally they are separate from other dogs and in a place where the female is comfortable. The characteristics about them that I want to have are that they be easily cleanable, both, and I mean that in a daily sense or a multiple times per day sense that they're cleanable. But I also want to be able to really clean and sanitize, between different females coming to have their litters. It needs to be dry, warm, and protected from drafts. And it should confine the puppies to a limited environment, but allowing mom in and out. So the thing that meets a lot of these qualifications, oddly enough, is one of those kiddie pools, like from the dollar store, because I can clean that with a cleaner. I can bleach it, and let it dry in the sun in between litters and things like that. So I know that doesn't work for every situation, but things to think about. How can I put these characteristics into where I usually have the dogs whelp and things like that? How can I make things cleaner, and how can I keep diseases from spreading, from one litter to another and that kind of thing. Ideally, we introduce the dam to this area near the end of her pregnancy. So she's got some time to become comfortable in this area and that kind of thing. So nutrition during pregnancy, I heard that you've had whole talks on nutrition. So I'll just mention the part that I'm interested in, which is during pregnancy and lactation. So the last half of pregnancy, ideally after you've confirmed, that she's pregnant, gradually switch her to a high quality puppy food. And we aim for not large breed puppy foods, even if you're going to feed the puppies large breed puppy food as they grow up. We want to feed the females just a regular puppy food, not the large breed variety. And then after whelping, feed mom that same puppy food ad lib. And this is the one and only time in a dog's life that I say feed her as much as she will eat, because this is the most nutrient draining time that any dog ever experiences. It's she's making a lot of food for a lot of babies a lot of times. So so as much as she'll eat is fine. And then you want to continue on that puppy food until she weans the puppies, and then gradually switch back to the high quality adult food that she was eating originally. So let's go through whelping, which, like I said, whelping is kind of the normal process. Dystocia is the abnormal process. Hopefully, most of your experience is very normal, happy whelping and that kind of thing. So we'll just go through what should happen. So there's 3 stages. Stage 1 is where, you know, the female becomes uncomfortable, is restless, is panting. They often go off feed. And that can last somewhere between 12 and 36 hours. The 36-hour girls are often the first-time moms. You know, they just don't know what's happening. They're a little bit anxious and concerned. And so their stage 1 labor is often a little bit longer. The experienced moms are going to be, you know, closer to that 12-hour mark. Stage 2 is where we start passing fetal fluids, feti. You're starting to see those strong, you know, coordinated abdominal contractions. And then stage 3 is the passing of placentas. So in canine labor, it's normal to alternate between stage 2 and stage 3. You know, she might pass like a couple of puppies and then a couple of placentas and then go back to a puppy and then a placenta. So there's not a hard and fast, you know, stoppage of stage 2 where stage 3 starts or anything like that. And a lot of girls will consume the placenta. It doesn't often hurt them, although it can cause a little bit of GI distress and stuff. It's a food that they're not used to. Thankfully, retained placentas are rare. So if you're like somebody that's been in equine reproduction and you're used to, you know, stringing out that whole equine placenta looking for little tiny rips and tears or things like that, dogs are a wholly different animal. So thankfully, retained placenta is not something that we see very frequently, and it's almost impossible for us to actually, you know, count all the placentas, because sometimes she reaches back there and eats it before we even know that she passed it. So we love to be able to monitor these girls, and so for any dog, but especially, you know, the livestock guardian breeds that might be a little bit less comfortable around humans, you may want to consider a camera system. Those are, you know, available in, you know, widely available and, you know, coming down in price quite a bit. So, you know, we don't want to cause stress to her, because stress can certainly stop the labor process. So if you coming in to check on her every hour or 2 is going to make her, you know, uncomfortable and stressed out, then I would probably think about a camera system or some other way of monitoring her that's not going to stress her out. So dystocia is abnormal labor. And so signs of trouble kind of depend on what mom's doing. So I've got all of these time periods up there, and they vary based on what mom's doing. So for instance, the first time I want you to keep in mind is 30 minutes. And that has to do with a mom who is like bearing down, contracting constantly, you know, really, really just pushing, not doing much else other than pushing. So if that goes on for more than 30 minutes, that could be a sign of a problem with a puppy. So if mom is kind of intermittently pushing, and then, you know, she takes a walk around and investigates the puppy she's already had, and then she pushes a little bit more and that kind of thing, that can go on for up to 2 hours before I really get too awful concerned. And then some moms, especially moms of large litters, you know, they might just take a nap in the middle, and that's okay. So I don't like to go longer than 4 hours total in between puppies. But if mom is very relaxed, taking a nap, then I give her, you know, up to 4 hours. Other signs of trouble can be black, green, or red vulvar discharge with no puppy produced. So it's normal to get a little bit of green discharge, when the puppy and or placenta comes out. So that's fine, but it's just a large amount of green discharge with no puppy that might be abnormal. So the treatment is typically to seek veterinary care. And so for some people, that just involves a phone call at first, to contact your veterinarian and say, this is what I'm seeing. What do you think? I don't necessarily recommend packing your dog up in the car and getting the lights and sirens on and going straight to the vet. Sometimes, we start with a phone call and just say, here's what I'm seeing. Do you think this is something I need to bring her in for or not? Because the whole process of getting her in the car and that kind of thing will likely stop her labor. And keep in mind that most dogs do deliver puppies in the evening or overnight. So you need to have a plan for what might happen in the off hours. And so if there is a problem, your veterinarian will determine what the appropriate treatment is, whether that be, what's called a controlled assisted vaginal delivery or a C-section or something, a third option. And that'll be based on things like the amount of stress that the puppies are under, fetal size, dam factors. If she's got 5 more puppies inside and she's just completely exhausted, then a C-section might be indicated because she's just kind of running out of energy quickly. So moving on to our healthy puppies, once they're born, they should gain about 10% of their birth weight daily. And so failure to gain or weight loss is often the first sign of a problem. So you might not notice that a particular puppy, isn't nursing and you might not have the opportunity to observe them very often, but kind of weighing them once a day can give you some early insight into a potential issue. So individual puppy identification is really, really helpful. So some of these breeds are, pretty, they're all like colored alike. So it's not like you can pick them out by their speckles or spots or that kind of thing. So they make, little colored Velcro collars, or I've seen people put a blaze of nail polish kind of over the shoulder blade area, every few days. There's lots of creative ways to identify individual puppies, but whatever works for you and your system, then you can know, okay, green collar male, weighed 16 ounces at birth and 2 days later he weighs 14 ounces. This is a potential issue. So some neonatal mortality is to some degree normal, but it should be less than 10%. So the preventable causes of neonatal loss are things like hypothermia. So when I was talking about that whelping area that doesn't allow the puppies to get too far away, it's because puppies can roll away and end up further from mom and the other puppies than they mean to, and they can get cold. And a cold puppy is in danger, in danger of not being able to digest its food and potentially exposing itself to other disease and that kind of thing. Infectious diseases, which is why I talked about, really having a whelping area that you can disinfect in between litters, and keeping the whelping area free of other dogs as well. And then inadequate milk intake or milk production. So hopefully you would pick up on the inadequate milk intake with, kind of your daily puppy assessment. And then milk production, if you're seeing a lot of puppies who are latching on really well, really have good, strong suckle reflexes, and kind of are leaving that nipple not satisfied, like kind of continuing to cry and that kind of thing, rather than dropping off that nipple after about 10 or 15 minutes in a happy sleep with a full belly, that might be an indication that that milk production is a little lagging behind. So it would be an indication to potentially intervene. So early veterinary intervention can reduce puppy losses. So if we can, kind of get involved with when you're starting to see problems in the litter, we may be able to help that puppy or keep the losses from adding up throughout the litter. So deworming, and I'll be honest, my experience is mostly kind of in the Midwest or Northeast and that kind of thing. So this may or may not be appropriate for Texas, but typically what I tell folks here is that dams during pregnancy can take fenbendazole orally, starting on about day 40 of pregnancy. So that's like Safeguard. And then puppies can be dewormed with pyrantel pamoate orally at 2, 4, 6, and 8 weeks of age. But definitely, I would encourage you to chat with your vet there in Texas, because this could be totally different there. And you might have a more specific case or concern in your particular breeding situation that your vet can help you with. So weaning, we can start soft weaning at 3 or 4 weeks, where we make a puppy gruel, which is a combination of moist puppy puree food and puppy milk replacer, and just kind of let those puppies, roll in it, walk through it. Eventually, hopefully they'll eat a little bit of it and figure out like, oh, I eat food. And that's helpful for 2 things. A, at 3 to 4 weeks is when the puppies are the most nutrient draining to the dam, and it helps weaning go better. So we want to wean them completely by 4, or at the very latest 5 weeks of age. So we may need to separate mom from the litter. Basically, the puppies aren't likely to just decide to stop drinking milk. So somebody has to tell them no. Some dams will start to, kind of growl at their puppies because they're starting to grow teeth at this point. So if she's doing that, then absolutely leave puppies with mom. But, some moms will continue to let the puppies nurse. And so we really want her to be off the hook as far as nursing by the time the puppies are 4 or 5 weeks of age. So you may have to separate them for periods of time or whatever seems to work well for your setup. So vaccines, puppies can get their first distemper parvo combination vaccines between 6 and 8 weeks of age. Those are certainly available, at Tractor Supply stores and things like that. You do need to make sure that they've been stored properly before you buy them, after you buy them, and that they're administered properly. So I'm showing my veterinary bias, but I'd certainly recommend a veterinary exam for the litter at the time of that first vaccine, so that the vet can check for common congenital issues, hernias, cleft palates, heart murmurs, undescended testicles, things like that. And they can give you puppy health certificates to send with those puppies, that you plan to sell. So there is a cost associated with that, certainly, but you can absolutely pass that cost along to your puppy buyers, so that you aren't actually out that money that you're paying for the veterinary input. As far as puppy sales go, it is important to keep the puppies with the litter until at least they're 8 weeks of age. That's important for socialization and learning and that kind of thing, or longer. So let's go back to mom and talk about, what is a normal, mom in the postpartum period, and what are some problems we need to look out for. So normal dams, and we'll give them a break for the first day or 2 after they have delivered puppies. But outside of that, very, very postpartum period, they should have an excellent appetite. And that appetite should peak at 3 to 4 weeks post-whelping, coinciding with the period of the highest nutrient demand from the puppies. She should have good milk production and be very attentive to the puppies. And she should have some vaginal discharge. And so that gets a little bit confusing, because we're going to talk about a couple of situations where the mom is actually having some trouble and she has vaginal discharge. So telling the difference between normal from abnormal vaginal discharge can sometimes be a little bit difficult. But at the end of the day, you know your dog's better than anyone else. So if anything about her seems a little off, seems a little funny, a call to your veterinarian is certainly in order. So treatment during pregnancy and lactation, it's not the time for DIY stuff, just because there is, we do need to be careful about what medications we're using and how those are able to cross into the puppies or cross through the milk and things like that. So really only make sure you're only given medications and treatments on the order of your veterinarian. And even over-the-counter things can be dangerous. Even some medications that are perfectly fine for any other time. I'm thinking of some like flea and tick medications are not okay for pregnancy and lactation. So definitely make sure that you're checking anything you're given to the dog with your vet. So let's go through some problems. So first problem is metritis, which is a post-whelping uterine infection. And so the hallmarks of metritis, she will often have a fever and potentially some foul-smelling vaginal discharge, although, the smell is maybe less telling. And like I said, vaginal discharge alone is normal. So who's to say if this is the normal or the abnormal vaginal discharge? She'll also usually go off feed, so she'll have some anorexia, and so that definitely requires veterinary care, both for her health as well as the puppy development and nutrition, because as she goes off feed and has a fever, her milk production is going to go way down. So make sure you're watching for that. The next, kind of somewhat common postpartum issue is mastitis. So typically what you would see with that is hot, red, swollen, painful mammary gland. And a lot of times it's just one, but it can be more than one in the mammary chain. The milk may kind of look abnormal. It can, kind of look a little yellowy, a little clotted, and that kind of thing. She often has a fever and she will often go off feed as well. That requires veterinary care as well. And the care can range from, some appropriate antibiotics for lactation and allowing the puppies to continue to nurse, all the way to, kind of a sudden, takeover of puppy feeding and kind of drying mom off pretty quickly. It kind of depends on her overall clinical signs and what bug is causing the issue. People ask a lot about back-to-back litters. And I would say for a dam who's having normal whelping, normal weaning, good mothering instincts, that kind of thing, that's probably not a problem. It's fine for her. We do want to consider the season when the puppies will be born. So if this is a female that has cycles every 6 months and she had, her last litter in June, then we'd expect her to come back into heat in October and potentially deliver puppies in December. So it can be a lot harder to keep puppies warm in December than it was in June, especially, in an outdoor like barn type environment. So consider that, as well as puppy marketing. Are the people who are buying your puppies, do they want to buy puppies in February or do they tend to wait until springtime? So from a dog health perspective, not a lot of concerns there, as long as everything was normal, went well, etc. But there may be some considerations from like a puppy perspective. So I wanted to mention one last issue called Pyometra. So this is Pyometra is a infection of the uterus, and she is most at risk for that 2 to 8 weeks after a heat cycle. So this is different than metritis, which happens post-whelping. This actually happens earlier than that, and it's usually not associated with a pregnancy. So it can happen on bred or non-bred cycles, and signs that you might see. Sometimes she'll be drinking a lot of water. Sometimes she'll have, some vaginal discharge, be off feed. She may or may not have a fever. And it does require veterinary treatment. Some of these girls are pretty sick from it. The most common treatment for Pyometra is surgical, to go in and take the uterus and ovaries out, which obviously is an end to her breeding career. And older females are predisposed. So, the typical patient with a pyo is 8, 9, 10 years old. So one of the best things that you can do after your older females are done with their breeding career is to go ahead and spay them when they're otherwise healthy. And that takes that risk of Pyometra to zero. So just a note on infertility, I don't think this is a huge problem in your breeds in general, but if you are experiencing some infertility, your vet can certainly help to try to investigate that. If you have a particularly valuable male or female that you would love to contribute, some genes to the gene pool, but haven't been successful at getting a litter, you can certainly check with your vet on, things that they can do as far as semen analyses or semen culture for the females, ultrasounds, hormone testing, uterine culture. So those are not things that we do routinely for any breeding dog, but certainly if you have, this prize dog that's just the best and you can't get a litter out of him or her, your veterinarian may be able to help you with that. So that was my quick crash course through all things repro. I'm very happy to kind of take your questions and things that might be more specific to your situations with guardian dogs and that kind of thing.
So we have one question so far in the chat. It's regarding milk production, and so it says, if the dam's milk supply is not in during whelping, how long should you wait to decide if you have a milk supply problem and then supplement it?
Yeah, so if her milk isn't coming in as she's delivering puppies, then you likely need to supplement. Puppies need nutrition quickly after they're born. It's very important that they get colostrum, which is like mom's first milk, within the first 12 hours or so of life. And so, you may have to look into colostrum supplements and that kind of thing. There are things that your vet can help you with as far as kind of giving puppies serum, which is kind of spun down blood from mom or from another dog on your property. To make up for the lack of colostrum, but if mom, doesn't have milk at all or doesn't have enough milk, you really do need to get involved pretty quickly to make sure those puppies are getting nutrition.
The next question says, you mentioned ovulation timing. What's involved with that?
Yeah, so most of the time it involves a blood sample plus or minus getting what's called a vaginal cytology sample. And in the case of the blood sample, typically we draw blood every other day to every day, depending on how tight we want that ovulation timing to be. So for girls that we plan to breed naturally or with, like a side-by-side AI situation, or even shipped chilled semen, every other day is likely fine. Potentially for the girl that we're going to breed with frozen semen, where we know we have a really short lifespan, we're gonna draw her blood every day. And so that's done at your vet. They would send off for progesterone numbers and kind of track her cycle throughout to get an idea of exactly what day she ovulated and be able to give you that really tight whelping window.
I guess I had a couple questions. How often should you deworm your female during pregnancy?
So the mom, you can start about day 40 with Safeguard, fenbendazole. Well, and again, I qualify that with, I'm giving you an Ohio perspective. It's possible that the worms in Texas are difficult. Everything's bigger in Texas, right? I don't know. So you can start with fenbendazole at day 40. That's to prevent some of the transplacental migration of parasites, as well as potentially the transmammary migration. And then you can deworm the puppies with Strongid, Pyrantel, Nemex. It's got lots of names. At 2, 4, 6, and 8 weeks of age orally.
Another question came up. I'm not sure if you're familiar with the cedars that they use for sheep and cattle.
Mm-hmm.
But somebody was wondering if there's anything like that similar for dogs to impact cycling.
Not that I have I've never seen a cedar. We do have some implants of GnRH that they're not available in the US, but I think you can import them from Australia to try to, bring a bitch in or there are actually some implants that are more for felines that are intended to keep them from cycling. So there are some rare things like that, but the dogs are just kind of a different species, so we can't do as much with their cycle management as we can with those like polyestrous species who kind of have that 21, 28 day cycle where they kind of come into heat and then go out as far as like sinking them and that kind of thing.
The next question is, do you tend to see much difference between in-house progesterone, the example was Index, versus sent out to labs like Antec?
So absolutely you can. The IDEX in-house test came out, I want to say a couple of years ago. And at first the reproductive veterinarians of America rejoiced because we said, oh, great. A lot of us already have these IDEX testing machines and so we can get, quicker turnaround rather than waiting 24 hours. We can get it in 10 or 15 minutes. And the rejoicing was quickly followed by a little bit of disappointment because we were finding that those numbers did not correlate with the send out labs as much. So I think that, some folks have developed, almost like a chart to say, okay, if the in-house lab says this, then that correlates to this other number at the send out lab. But I think a lot of us honestly have kind of, continued with the send out progesterones just because it's important. For most breeding purposes, a 24-hour turnaround time is fine. For things like C-section timing, where it's like, oh, should I go to C-section today or not? 24 hours is a little too much. So we still, potentially use it for that. And I think IDEX is continuing to work on that test to make it more accurate so that we can use it instead of the send out labs.
How long is the stage 2 and stage 3 of whelping? I mean, is there a general length of time that those should last, or?
Not total time, because a lot of it's going to depend on litter size. A 4 puppy litter, should be delivered before a 17 puppy litter. So what I usually concentrate on is time between puppies, more than a total amount of time.
Okay. Well, are there any other questions from the group out there before we wrap up here? Well, Dr. Gibson, I just want to thank you again for presenting with us today. Folks, for those that are still on, this presentation will be posted on our YouTube channel. And if you have any other questions later on that come up, feel free to email me and I can get those to Dr. Gibson and get you an answer. I do want to thank the Sheep and Goat Predator Management Board, Dr. Redden, our Center Director, and Robert Pritz. And then also thank you to our sponsor, Lone Star Tracking. So with that, I'll appreciate everybody checking in. Our next webinar will be in September, and it'll be on technology to help with livestock guardian dog management, mainly focusing on GPS trackers. So thank you again, everybody, and we'll see you in September.